Yeah. Okay, so good evening and welcome. My name is Roseanne. I'm from the Hicksville Public Library, and I want to thank everyone for joining us tonight and welcome you to this virtual CPR and first aid class. This class is brought to you by Assemblyman Michael Montesano and the Katz Institute for Women's Health. Before we get started, I want to let you know that we're going to be muting everyone during the presentation. If you have any questions or concerns, you could either use the chat function or you could use the raise hand function. We'll call on you. There'll also be a question and answer session at the end. And now I'd like to introduce you to Assemblyman Montesano. He's the Assemblyman for Hicksville, which is the 15th Assembly District, and his office is actually right by the library. So thank you very much, Assemblyman Montesano, for sponsoring this event.
Thank you, Roseanne. You're welcome, and thank you for providing the link for everybody to attend this. You know, the CPR in today's times has become much more important. You know, there's a lot of different problems going on between COVID and the illnesses that are striking people, and I think it's great for people to learn how to do this, especially those who have small children. God forbid something should happen to them. I'd like to thank Katz Women's Foundation for putting this on and providing the instruction. So I hope it's a fruitful program for everyone and that we get something from it. And I'm just going to say now I'm at the Town Hall in Oyster Bay attending the presentation for Seritage over at the Sears property. So we'll be going over the plans and for that property and the hearing. So I hope you'll excuse me while I step away to participate in that hearing because it benefits all of us in Hicksville. So thank you again, Roseanne, and everyone, and I hope everyone enjoys the program.
Thank you very much. Okay, so now we're going to hand it over to Catherine.
Hi, everybody. Thank you, Mr. Monsanto, and for the Hicksville Library. Welcome, everybody. Glad to see you here tonight. I'm going to share a PowerPoint with you, but just a few slides so that it helps in explaining what we're going to be talking about. So give me just 1 second. And I'll put this on presentation mode. Okay. So I'm Catherine Blotio. With me also is Kim McHugh. We're from the Katz Institute for Women's Health at Northwell Health. And emergency first aid. So you might be asking yourself, what is first aid? And you probably know that already. Did you come up with all the facets of what first aid is? I'm going to show you this definition. So it's the immediate care given to the ill or injured until medical professional help arrives. That's an important phrase. It means that first aid, we're doing it immediately because we're there, but we're not relying on our own skills. We're always getting professional medical help, and you probably is calling 911, and that is at the bottom. But before you even decide to help, many people have the desire to help, but there are times when you can't even help because the situation might be dangerous. That's the cardinal rule. Never put yourself in danger, because if you get injured, now you've just complicated what would have been a simpler rescue. So if you get injured, you're adding another victim. So you have to first survey the scene, make sure it's safe before you even enter. If somebody is in a pool and you don't swim, first rule, you don't go in. Maybe you throw something to them and tow them in. Or if they're in traffic, and you can think of a number of different scenarios. If a house is on fire, you never go in. So that's first. Make sure the scene is safe. Use personal protective equipment. That includes, everybody's familiar with masks now, a pocket mask for CPR if you were in that situation, and we're going to stay away from that. Today we're not doing any kind of mouth-to-mouth breathing, even with barrier devices. But I do have gloves. I put one on, and I'm going to show you, because a lot of people are using gloves and then they take them off improperly, and that kind of defeats the purpose. So when you put gloves on, you have to think dirty to dirty, clean to clean. All right, the outside of the gloves are dirty. They're considered dirty. Anything that I pick up on that scene, if there's blood and I pick those things up, they are also dirty. Any kind, you know, and that's just the terminology. What's clean? The inside of the glove is clean and my hands are clean. They're considered not contaminated. So when I remove gloves, I want to take the dirty outside glove and pinch the outside of the other glove. Notice I'm pinching it. And can you see okay, everybody? Danielle, you'll let me know. Or Roseanne, I meant. Sorry.
Yes, yes.
Okay. So I'm pinching the outside of the glove and I'm pulling it off inside out and grabbing it in the other gloved hand. Remember I said the hand was clean and the inside of the glove is clean? So now I'm going under the glove. I can go here or at the back, inside, and I'm pulling this glove off also inside out. So now I'm touching the inside, which is considered clean. This gets disposed of in a red hazard bag, or if you don't have that, a sandwich bag. Just put it in a baggie and then that gets discarded. Okay, the next step in that is treat for life. What that means is, let's say you have a scene and there is more than one victim. Maybe one person is crying, this is bad. Well, what do you know about that person? If you're thinking, well, they're breathing, you're right, they're breathing, which means they must have a heartbeat also. Perhaps you look on the other side and there's somebody lying there and they are not making a sound and they are not moving. That person is critical. They might not be breathing at all. And then they could be imminently in danger of dying. So you would treat that person first, treat for life. And finally, as we said before, always call 911. Okay, calling 911. I'm going to ask you as the audience some questions. And if you know how to type in the chat some of the examples of things that you would do. You would call 911 for. For example, would it be a splinter? Would it be a small abrasion, a scrape? What are some things, and I can't see the chat right now all the way up, so if anybody's writing in, I'm going to ask you to tell me what is being written.
Vera said anaphylaxis.
Excellent. That is absolutely correct, and we'll deal with that. So let's look at some of the other things. Vera, you were right on the money. You got the first one. Anaphylaxis is a severe allergic reaction that can be life-threatening. Unconsciousness, anyone who complains of chest pain. Injuries, severe head bleeding. I don't know why that's separated there, but a stroke, seizure. When a condition appears to worsen, let's say you look at somebody and maybe they're having difficulty breathing, but it's very slight and you think, oh, they're just out of breath. But then it seems to worsen. Now that's when you want to call. Any condition that gets, you want to call, or maybe it's just a situation you don't know what to do. I think any time that you are in a situation where you think, should I call 911? Then you should call. All right, another thing, well, we said you want to treat for life. So we impress upon you that you should learn CPR. CPR really is easy. And my coworker, Kim, is going to show you. So I will stop sharing right now. And I'm going to turn off my video so you can see Kim demonstrate the very basic CPR.
Hi, everyone. Good evening. My name is Kim McHugh. I am one of the project managers at the Katz Institute for Women's Health, and I'm here to talk about something that's really important, and it's hands-only CPR. And the reason why we're teaching hands-only CPR and the American Heart Association is pushing hands-only CPR, because as you know, with COVID being out there, and as people are more and more not uncomfortable with giving breaths, we can do just as much help by just giving compressions. When a person has cardiac arrest, Their survival depends on immediately getting CPR from someone nearby. Hands-only CPR is something everyone can learn. It's 2 steps, 2 easy steps. The first step is to call 911, and most of us have cell phones now, which we usually have them attached to some part of us. And the second step is to push hard and fast. That's where the compressions come in. So right now, I'm going to do a quick demonstration of what these 2 steps look like, and then I'm going to explain how to do them 1 step at a time. So the first thing is I'm going to say, call 911. So I call 911, expose the chest. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 24, 25, 26, 27, 28, 29, 30. Okay. Now for my step-by-step instructions. So obviously you saw me call 911 on the cell phone, or if you have a home phone, you can also do it there. You can also pass the phone to somebody else and say, call 911. If you see a teen or adult collapse, immediately, that's what you do, call 911. Now is the compressions, and I'm saying you're gonna push hard and fast. So the placement is you're gonna take your hands, you're gonna interlock one hand on top of another, just like this. You're gonna place the heel of your hands in the center of the chest, in the center of the nipple line, just the lower half of the breastbone. And then you're going to push hard and fast, straight down. If you notice, I'm allowing the chest to come back up. That's called recoil. So once again, have my hand, put my other hand over it. I'm going to place it in the center of the chest on the lower half of the breastbone and push straight down. Now, you see when I'm pressing down I'm pressing down at least 2 inches. And the rate that I'm going to is I'm going to be at a rate of 100 to 120 beats per minute. If you know the song Staying Alive by the Bee Gees or Crazy in Love by Beyonce, they go to the same rhythm of that song. So it's something like, staying alive, staying alive, That's 100 to 120 beats per minute, and I'm pushing down at least 2 inches. You're going to continue doing your compressions until the victim becomes conscious or until help arrives. The second part of this demonstration is I'm going to show you the difference between doing compressions on an adult and a child. The American Heart Association refers to a child as ages 1 to 8 years old, okay? They're basically the same exact placement. So I'm going to expose the chest, okay? The only difference is depending on the size of the child and also the size of the person doing the compressions, you're able to use one hand if needed. That way you don't feel like you're putting so much pressure down. It's the same place, center of the chest, lower half of the breastbone, and you're going to push down about 2 inches. For an adult, it's at least 2 inches. A child is about 2 inches. So once again, I'm going to call 911, and then I'm going to push hard and push fast. The same rate. Staying alive, staying alive. Sorry, guys. And that's it. That's all you need to know. That's the 2 steps of hands-only CPR. Thank you.
Okay, I'm coming back on with my video. All right, and I'm going to share again. Thank you. Were there any questions for Kim? Did we want to wait?
We don't have any questions in the chat right now.
Okay, so we'll continue. Looks like I have to. All right, there we go. So next we're going to talk about medical emergencies. You know, this one always fascinates me because have you ever,
Oh.
even for yourself,
I'm sorry,
You-
excuse me, Catherine.
Uh,
We just
yeah.
got a question. How deep for an infant?
oh, okay.
How
Kim,
deep for a child or an adult?
infant,
Infant.
Oh, an infant.
an inch
Infant
and a half.
different, and actually the hand placement is very different. Kathy?
Yeah, I have an infant. Maybe we can even show that at the end, but I'll have to give me 2 seconds at the end. But it's an inch and a half. So that's about 5 centimeters, I think. So it's a little bit less than the child. We said with the child was about 2 inches, Kim said, and it's at least 2 inches for the adult. For the infant, it's an inch and a half. And you're only using 2 fingers, either these 2 or these middle 2. Okay, to do the compressions. That didn't, I'll show you that later.
Okay,
Okay.
and we have one more question. What if you can't expose the chest? Is it okay to do it from above the clothes?
That's like, I don't know, Kim, how would, I don't think I would. Why would you not be able to expose the clothes? Are you? My
I
feeling,
always say that the compressions are better and your placement is easier to make when you expose the chest because you can actually see the nipple line and you're more in contact. So that means that your compressions are going to be better, especially if they have a sweatshirt or something like that on. I have an infant here, Kathy, if you want me to show the compressions.
sure, I'll stop sharing, absolutely.
Okay. Okay. Here I have an infant. Now it's going to be almost the same placement. So here's my nipple line for the infant. You're going to go 1 finger length down from the center of the nipple line. So I'm right here. If you notice, I'm using 2 fingers. And what I'm gonna do is I'm gonna push straight down. So it's 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16. It's an inch and a half and it's the same mark, nipple line, and you're gonna go a finger down. Straight down you're pushing and you're allowing that chest to recoil. Okay?
Great, I'm glad you had that, thank you.
You're welcome.
Just more, while I'm sharing the screen again, one more comment. One of the reasons I hesitate, I mean, if you absolutely cannot get the clothes off, then by all means, don't delay doing CPR. But one of the concerns that I have is I know that the future health, the advanced care is going to bring in defibrillator, an AED, and that has to be put on bare skin. But once they come with that defibrillator, they'll cut the clothes if you weren't able to, you know, undress or lift them up or something and get them off. So it is important eventually to get a bare skin. And as Kim said, it's important to get that good landmark so you're in the right spot. You want to be right over the heart, not somewhere else. But
And
okay.
of course, anything is better than nothing. So
Exactly. Yes. And why I said absolutely begin. If you can't do it, don't let that stop you from giving care. So, all right. Yeah, thank you for that, Kim. So now we're going to talk about a heart attack. Now, a heart attack is what Kim was showing, what you would do on somebody whose heart has stopped. And that means stop beating in a rhythmic order. People in cardiac arrest actually have some motion a lot of times in the heart, but it's chaotic and it's not pumping blood. A heart attack is a different kind of thing. And a heart attack is usually a vascular thing. It is a vascular thing where blood is not getting to the heart. And so the heart muscle starts to suffer because it's not getting that oxygen it needs. Certain signs and symptoms, signs being something you can see, a symptom, something the person would feel. There are certain signs and symptoms that would be experienced during a heart attack. Do you know any of them? I'm going to start putting some up. Chest pain. That's a classic, but there are a number of no chest pain and still be having a heart attack. Nausea, vomiting. This one, I have to tell you, has impressed me lately when I've met women who have survived heart attacks. And two of them that I met, one lady was having nausea for a couple of days. And I thought, wow, that's really tricky, because if I even saw that or heard it, I would think maybe she's coming down with the flu, maybe this, maybe something else. But if somebody is having this nausea that comes on, it's best to get it checked out. I think that's what I would do. They don't have a fever, because usually if you have an infection, you're going to have a fever. But this is nausea without that fever. Okay, shortness of breath. So difficulty breathing. Some people describe it as a weight on their chest. Pale, sweaty, cold skin. The oxygen it needs, it's affecting everything in your body, and you feel that kind of shocky feeling. And again, as I said, asymptomatic or no signs or symptoms, a silent myocardial infarction. So I don't know if there are any questions about that. If you have any, you can save them till the end. We'll come back to it. But if somebody is experiencing any of these signs, if you think they might be having a heart attack, what should you do? Right, call 911. You don't wait until they collapse. Call 911 and tell them, the operator, that you think this person is having a heart attack, or you're not sure, but they don't look good, they have chest pain, they have nausea, and trust me, they will come. Another problem that can be a medical emergency is a stroke. We call it a brain attack, because now instead of the heart not getting the blood it needs, it's the brain. So a stroke is a disruption of blood to the blood flow to a part of the brain, causing permanent damage to brain tissue. Now, many times people are able to regain some of the loss that they have, but this disruption of blood to the brain can happen in two ways. It can be by bleeding out, so that could be that kind of a stroke, or the majority of them are caused by a clot. A blood clot blocks the flow of blood. The important thing about this is that that clot, they have medications to disrupt that and completely, I want to say, disintegrate the clot, so that it's really great, but you need to act quickly. So the acronym, excuse me, first let's look at this, the signs and symptoms. Sudden, that's usually what happens, a sudden inability to move the nerve, a sudden slurring of speech, you know, a sudden change in the behavior, inability to close the eyelid, drooping of the mouth. It's going to be on one side of the body. So here's the acronym to help you remember. Remember that number one, you have to act fast. So the acronym is FAST, and that stands for face. If you ask the person to smile and one side is down, like you saw in the picture, that's one indication. If you ask them to close their eyes and lift their arms up, now if they're having a stroke, very often one side, they can't keep it up as high, and they don't even realize that they're not lifting their arms equally. Repeat a simple sentence. If you say, can you say the pizza is ready? And they say, the pizza is ready. Well, you didn't need this class to find out something was wrong. You should be you're calling 911. And the time, note the time. when a hospital deals with a stroke patient, they are on a very strict clock because they know the sooner they can get those clot busting drugs to the victim, the better off they'll be. But first they have to make sure, is this a bleeding injury or is it a clot? If it's a bleeding injury, they're not going to give the same drug. So they have to do some tests. When they find out what it is, if it's a clot, they can break it up. So the time is important. If you're looking at somebody and you think they might be suffering a stroke, keep them calm, call 911 and call immediately and tell them what. All right, next is choking. If somebody is choking, this will block their airway and it will certainly get their attention, regardless of the age of the victim, from small babies to adults. If you stop breathing for some reason, for a foreign body in your throat, it's going to make you stop. And people who do choke, sometimes this is the classic sign as shown in the video. Sorry, not a video, in the PowerPoint, but that's a classic. But some people just stop and I have been told these stories. People who are with them kind of know. They say, "Are you choking?" And that's exactly what you should do. Ask them, "Are you choking?" And then I can show you what to do if they are choking or if you yourself are choking and you're alone. So I'm going to have to stand to do this. But the important part is I want you to see where my waist is. Now, actually, this is my waist and these are my hips. I want your hands, if you want to join with me and do this, put your hands on your hips, right on top of the bone. Now slide your fingers forward, and when your middle finger comes to your belly button, that's your landmark. I'm keeping my pointer finger down as well, and then I'm making a fist with the other hand. Notice that my thumb is outside of my fingers. Now put the thumb side of your fist just above those two fingers that you're landmarking. Now take that other hand and cover the fist. Okay, doesn't matter which side, you can do this way too, but I'm just used to here. All right, now I'm going to take this hand, cover the fist, and if this was a person in front of me, I would actually thrust inward and upward. My arms go in and up, that would help relieve the choke. Or I could do this on myself and actually fall on my fist on a table to help relieve that choking. This is the same technique that you would use for a child, an adult or a child. And let's give you the definition. A child would be anybody older than a year up to 8 years old. An adult would be somebody who's 8 and up. Did I just say that? So a child 1 to 8 and the adult beyond that. And Kim, if you have that infant ready, maybe we can show the choking relief for an infant.
Sure. 1 minute. Let me just get it positioned. Hold on.
Okay. I'm going to stop sharing while you do that.
Okay. Hold on. Okay. Hi, everyone. This is my infant again. And I'm going to show you what to do if your infant is choking. And it's a little different. So here's my infant and they're choking. The first thing you always want to do, and everybody knows this, is you always want to make sure that you're supporting the head of your infant. So if you notice, I'm cupping the bony part of the jaw here, okay? So what I'm gonna do is I have my hands on the bony part of the jaw, and I'm gonna stick the infant almost like a football hold, like this. If you notice, the infant is in between my arm and my body. And the reason I'm holding them like this is because it's an infant, and if it's choking, it's conscious right now. So it's gonna be trying to move. If an infant is choking though, they're not crying, okay? There's no sound. Usually there'll be a facial color, but there's no sound. So I'm supporting the head. I place the infant in between my arm and my body to support it. If you notice, the head is lower than the rest of the body, okay? It's slightly lower because we want whatever's lodged in there to be moving forward, okay? Now, my infant's head is slightly lower than the rest of its body. I'm supporting the head and I'm keeping it still in this almost like a, I hate to say it, but a football hold. And then what I'm going to do is with the palm of my hand, I'm going to give it 5 back slaps on the back of the infant's shoulder blades. So it's 1, 2, 3, 4, 5. Now, I know some of you are saying, oh, that's an infant. How do you know how hard to hit it? You are hitting, you're giving it a good hit. And the reason why I'm saying that, a good slap, is because you want to dislodge what's ever in there. So if you're just tapping it, there's really, it's not going to be able to, you want to get this, whatever's stuck in there to move. So you're going to do 5 back slaps, 1, 2, 3, 4, 5. Then what you're going to do now is chest thrusts. And what they are is basically the same thing as a compression on an infant. But you're going to support the head. Once again, you're going to flip the infant over. Okay, once again, you're holding it and you're giving it the compressions. 1, 2, 3, 4, 5. Nothing comes out. You're going to support the head again. Head slightly lower than the rest of the body. I'm in a good position. And 1, 2, 3, 4, 5. Another good way to do this, and I was trying to get it so I could show you, but I don't know if you'll be able to see it, is if you sit down, it also works very well because you're, oh, can't see it. So you're able to actually rest the infant on your leg. So if you notice, my leg's out, football hold, 5 back slaps, 3, 4, 5, support the head, flip it over, 1, 2, 3, 4, 5. Okay?
Thanks, Kim. That was great.
You're welcome.
Okay, and okay, so all right. Next, we will talk about diabetes. Diabetes is basically a condition where a person has difficulty. Their body does not balance the blood sugar well. It can be too high or it can be too low. But in first aid, we deal with it as if it's always low. And the reason for that is because that is the more critical situation. If somebody's blood sugar is too low, it is not a big margin of error. So we always give sugar as a first aider. Hospitals, they would do different things. People who are measuring their sugars, yes, they might give another treatment. But for us as a first aider, somebody has diabetes and they're having difficulty, we're going to give them sugar. So what would be some of the signals that would tell us? One, we might know that they're diabetic. If they become, they have a change in behavior, they're confused or irritable, they're not sleeping and not responding, they're hungry, they're thirsty, weak, they might be sweating again. Remember, this is that shocky kind of look, that sweating pale color when somebody's in shock or going into shock, or they might even go in, have a seizure. Now, if somebody's seizing, you're not going to be shoving things in their mouth, but so we'd like you to catch that early. If somebody tells you I'm a diabetic and I'm not feeling well and they're dizzy and disoriented, that's for you to get the sugar. What would be a good source? Well, you could give them orange juice or apple juice, high sugar content. You could give soda, but the thing that's not a Diet Coke or a diet soda. But the thing that's bad about or not as effective as, say, orange juice, is that the sodas tend to be carbonated, and so they're not as able to get as much down. But if that's what you have, you could use that as well. And that sugar will help them and relieve that situation. And you should call the doctor. They should go and be seen and make sure everything's okay. Well, we mentioned seizures, and there can be seizures from other causes. There can be a person within a seizure disorder, such as epilepsy. So in those cases, if a person starts to seize, and we usually think of the type that's the big movements where they're stiff all over and they might fall to the ground. In these cases, you really have to let the seizure run its course, or actually in any seizure. Sometimes it could be just a twitching or a blinking of the eyes. It might be barely noticeable. But speaking of those large muscle seizures, because that's something we've probably seen in the movies or on TV, don't try to restrain the person, just protect them from things around them. So move furniture. If they're near a chair or a table, move that away. If they're on a hard floor, you want to put a pillow or something soft to pad their head so they're not banging it against the floor. Again, do not restrain the victim, and don't put anything into the victim's mouth. Sometimes people were afraid that the person would swallow their tongue or bite their tongue. Number one, you're not going to swallow your tongue attached. And if they do bite their tongue, they usually do it immediately, and so you're too late anyway. But the problem with putting something in the mouth is they're likely going to bite and then have a choking obstruction. So you don't want to put something foreign in their mouth. When the seizure is over and it's run its course, you can just let them rest. They're usually going to be very exhausted. Turn them on their side, possibly, and just monitor them, and you should call 911. Now, if you have a family member who has seizures, sometimes when they're changing their medications or something happens, or they're overly fatigued or they're overly stressed, they might have a seizure and they're not really looking to go to the physician, to the doctor. But this is the protocol. Remember, we're talking about general first aid. It is to call 911. Again, you never deal with an issue by yourself. You always get professional help. All right, and then we have some injuries, bleeding injuries. Let's take one of the most common, a nosebleed. Tell me which way you think is better to stop a nosebleed. First, I'm going to pinch the nose below the cartilage. I'm pinching my nose right in the box if I should put my head forward or back. Now, if we don't have any answers, I'm going to tell you anyway, but do we have anyone who took a guess? Try to see it. So is it forward or back?
Alexandra said head back.
Okay. Thank you, Alexandra. Thank you for being brave to put that in there. Maybe many years ago you would have been right, but they changed it. They used to teach that actually, to put their head back, and that's why a lot of people still think that. It should be forward because you don't want people swallowing the blood, because it makes them nauseous sometimes, and that can cause coughing also, or choking. So we put the head forward and pinching the nose to help stop the bleed. Nosebleeds aren't really a serious deal, but they can be. They can be indicative of other things. So if you ever have somebody whose nose is bleeding and it's not stopping, might be that they're on some medication like Coumadin, which makes them bleed. They're going to have to go to the hospital. So don't think this is, oh my gosh, I'm crazy calling 911. No, you can't stop the bleeding, call 911. Sometimes if you're holding a nosebleed like this, it can also, be indicative of cancer. It can, pregnancy. So there are a lot of things, and don't be afraid to call. The other thing with this is usually your bleeding is from one nostril, not both. So if you ever have bleeding from both nostrils, or if it's the result of a fall and possibly a head injury, you don't want to stop that bleeding. If somebody you see there at the bottom of a ladder and they clearly fell, or that this was the case, do not stop that nosebleed. Minor bleeding, you should always wash to prevent infection. If a little child scrapes their knee, there's usually a direction, like they slide, and that's the direction of that abrasion. When you wash it, wash in that direction. Because if you go back and forth in the opposite way, you tend to aggravate the wound. You want to go in the same direction and keep the skin intact. So that's usually easy. Wash with soap and water. You might cover it if they like. Severe bleeding is another story. You have to stop the bleed. So before you worry about washing it, you want to just stop the bleeding. And the fact of the blood flow itself is enough to help rinse it, wash it. All right, now believe it or not, this is my person's arm, because I only have two and I need one to bend. So if I take this and this arm is bleeding, I'm taking some gauze pads and I'm applying pressure. I'm squeezing this so you can see that I'm applying pressure. I don't want to squeeze their arm too hard, but direct pressure. Oh, I did something wrong. I wonder if anyone caught it. But sorry, let me go back. Because I'm trying to play with this toilet paper roll, I did not put my gloves on.
I noticed you didn't put your gloves on, Kathy.
Thank you, Kim. I was testing you. You're a little, but I'm glad you saw that. So I do need my gloves. And what I should have done is given this to the person so that they could hold it on their own arm while I'm getting my gloves on. All right. So now they're still holding that bandage on while I'm putting my gloves on. This is taking me longer. Gotta snap up here. I'm gonna lose them. All right, so here they are. Now I can apply the direct pressure. Is that better, Kim?
Much better.
All right, so we're applying direct pressure and we're keeping our cells safe. When that bleeding stops a little bit, you can take, this is a roll bandage. And if you notice the arrows here, the blue arrows, that's where you want to go to open this package. Try to open these things any other way, you can't do it. That, and I have this roll bandage, and I'll take the end and I'm just going to wrap this around here. So it's snug, oops, but not so tight that I'm stopping the circulation. The reason I wanted to do this, I really want to show you. Kim, can you see it all right? Can they see? All right, I'm coming around. I want you to know how to double back. See, I'm doubling back and making two ends so that I can tie the ends over the wound. And this helps to add pressure over that wound to help control the bleeding. Remember when I first put the bandage on, I told them to hold, well, actually I put direct pressure on, but we apply direct pressure. Now this roll bandage acts as a pressure bandage to keep that in place. Most bleeding, you're going to be able to stop like that. Once you've finished, what should you do? Remove your gloves properly. And then after you dispose of your bandages properly, you want to wash your hands for 20 seconds. Okay, I was in the wrong thing. That's your severe bleeding. All right, we just have a couple of more things. How are we doing on time? We're good. We have plenty of time because I think we just have this last two things. Burns. Burns can be caused by heat. We all know about sunburns, hot water burns, electricity, even lightning, which was a form of electricity, and chemicals. The severity of a burn is going to depend upon how deep the skin is burned and the location of the burn. Obviously, if you're burned on the forearm, still no fun. It's a terribly painful injury. but this is a critical area. If you have swelling in the airway, in the eyes, that can be very dangerous. Also, the hands and the feet are a critical area. Can you think of why? It's because the skin is so thin in these areas, so it doesn't take a whole lot. There's not a lot of depth of skin, and that can be a severe burn because it will be deep very quickly. Also, as I said, the face and the genitals. So all of those are critical areas. What should you do to treat burns is to cool the burn. It makes sense. It's hot, you put on cold. Put your hand, if it's your hand or your arm burning, under cold running water. Not water, and do that copious, lots and lots of water for maybe 15, 20 minutes. It really does help. And then you can cover the burn loosely with sterile dressings. And I think this is our last one, muscle and bone injuries. Funny thing, it's the same treatment. And this is not going out for an Asian dish. This is actually an acronym for rest, ice, compress, and elevate. So if you sprain an ankle, well, first of all, let me explain the difference between a sprain, SP, and a strain, ST. A sprain is between ligaments, and ligaments are what hold bones together. So your bones come together at the joints. So you would sprain an ankle, you'd sprain a shoulder, but a strain, ST, is where the tendons attach, the tendons from the muscle attach to bone. So that would be like you have a back strain. You know, somebody lifts something too heavy and lifts it improperly. They might strain that muscle. They might strain a calf muscle. But as I said, the treatment is the same. Rest it. Stop doing what you're doing. If it's your ankle, lift that leg up. Or rest your arm if you sprained or strained the wrist or sprained your elbow. Stop moving it. And that's the second thing, immobilize. All right, just keep it still. You might wrap it. And then you put the cold on it. I'm sorry, there's two acronyms for this. It's the same type of or rest, immobilize, cold, and elevate. It's kind of the same thing. All right, so the cold, you're going to get a bag of ice and you put that on. So it's not direct ice on your arm, but maybe you put a cloth and then put the bag of ice, and that helps relieve the inflammation, and it helps lessen the pain as well. And if you can keep it on the ice, that is, for 20 minutes, that's one of the best things you can do. And it really does help your injuries heal better. Got to do that icing. It's very important. And then elevate. And all that is keeping some of that fluid that would normally cause pain and, you know, by gravity going down, it's going back to the heart where it belongs. Okay, let me make sure. Yep, that's it. So we left time for some questions if you have them. We've got 10 minutes.